was rumor. Investigators were just saying something's happening, something we haven't seen before. And so you had an inkling. You just didn't know how big an effect it would be.
On the day of the presentations, every seat was filled because this data were coming out.
You could hear this sort of buzzing in the room where people were sort of murmuring to each other.
And then Blackberries came out, and there's just lots of excitement and curiosity about what these data showed.
Wet AMD was very common. It was a very difficult and often unhappy condition to treat.
Although there were treatments,
They could either slow the progression of vision loss or stabilize vision at best.
We had one patient. She was losing vision. She was buying magnifiers.
And there's very little that we could do. So as a doctor, that sensation made me feel very inadequate.
they showed the top-line data, and frankly, my jaw dropped.
The patients actually gained vision, and more than 90% we could stabilize their vision. That changed the way we looked at the disease and how we could treat our patients.
You just look at the curves and draw a line through the data points, and you can see that this is a big innovation.
It was almost all the proof anyone needed.
I was surprised by, number one, how effective the treatment was. I mean, the magnitude of the benefit was really more than I had hoped for.
It changed the conversation with our patients. It was just an incredibly different feeling that you had when you go to the office and you see a patient.
We were able to help these patients not only maintain their vision, but also to improve it. Every time I think about Lucentis, I think about that one patient, because that's where it all started.
The introduction of Lucentis for the treatment of wet AMD represents one of the important milestones in the treatment of retinal degenerative disease, in my opinion.